Radiculopathy is a term used to describe the symptoms of an underlying spinal condition that compresses or irritates spinal nerves. Radiculopathy includes pain, numbness, tingling, or weakness along the path of a nerve. The human spine is comprised of the cervical spine, or neck, the thoracic spine, or chest, and the lumbar spine, or lower back. There are 24 vertebrae in the spine. Vertebrae are connected by several joints. The main joint is a flexible cushion between two vertebrae, called an intervertebral disc. At each level of the spine, spinal nerves exit on both the left and right sides. These branch out to enable movement and feeling throughout the body. Cervical nerves allow for motion and sensation in portions of the upper body, including the head, neck, shoulders, chest, arms, and hands. Thoracic nerves allow for motion and sensation in portions of the upper and middle body, including the shoulders, chest, abdomen, arms, hands, and upper and middle back. Finally, lumbar nerves allow for motion and sensation in the lower body, including the lower back, pelvis, buttocks, groin, legs, and feet. When a spinal nerve is irritated or injured, a person may experience radiculopathy. For example, if a spinal nerve in the lumbar region is irritated, radiating pain may be experienced along the nerve route, which begins at the lower back and travels to the leg. Radiculopathy is most commonly the result of a condition affecting the disc, such as a bulging or herniated disc that presses against the spinal nerves. Other causes may include degenerative disc disease, stenosis, bone spurs, tumor, trauma, diabetes. If you feel that you are experiencing pain, numbness, tingling, and/or weakness radiating from your back to your limbs, you should see a physician for an accurate diagnosis.